to the health and the safety of all Americans, I'm here to discuss our strategy to prevent and protect the American people from a possible outbreak. I appreciate Dr. Rich Carmona, the U.S. Surgeon General, Dr. Tony Fauci, Director of the National Institute of Allergy and Infectious Diseases. Scientists and doctors cannot tell us where or when the next pandemic will strike or how severe it'll be, but most agree at some point we are likely to face another pandemic. The virus has developed some characteristics needed to cause a pandemic. It has demonstrated the ability to infect human beings, and it has produced a fatal illness in humans. If the virus were to develop the capacity for sustained human-to-human transmission, it could spread quickly across the globe. Our country has been given fair warning of this danger to our homeland and time to prepare. Our strategy is designed to meet three critical goals. First, we must detect outbreaks that occur anywhere in the world. Second, we must protect the American people by stockpiling vaccines and antiviral drugs and improve our ability to rapidly produce new vaccines against a pandemic strain. And third, we must be ready to respond at the federal, state, and local levels in the event that a pandemic reaches our shores. And unlike storms or floods, which strike in an instant and then recede, a pandemic can continue spreading destruction in repeated waves that can last for a year or more. To respond to a pandemic, we need medical personnel and adequate supplies of equipment. In a pandemic, everything from syringes to hospital beds, respirators, masks, and protective equipment would be in short supply. To respond to a pandemic, the American people need to have information to protect themselves and others. In a pandemic, an infection carried by one person can be transmitted to many other people, and so every American must take personal responsibility for stopping the spread of the virus. By making critical investments today, we'll strengthen our ability to safeguard the American people. In the awful event of a devastating global pandemic, and at the same time, we'll bring our nation's public health and medical infrastructure more squarely in the 21st century. Leaders at every level of government have a responsibility to confront dangers before they appear and engage the American people on the best course of action. There is no pandemic flu in our country or in the world at this time. But if we wait for a pandemic to appear, it will be too late to prepare. And one day, many lives could be needlessly lost because we failed to act today.